Hello everyone, I just say welcome back to our question of the week. I'm Taylor.
I'm Lauren.
And I got good news. Tennis players, this week's for you. What are we talking about today, Lauren?
So this week we're going to talk about the top 5 most common tennis injuries, as well as how we can help you and help prevent those.
So what's number 1?
The first one is probably one of the most common. It's tennis elbow.
Okay. Let's generally talk about tennis elbow. Now, tennis elbow doesn't only happen to tennis players. So I just want to clarify that. And not all tennis players are going to get tennis elbow. But the reality of it is tennis elbow starts with, you're going to have pain on the outside of your elbow. So typically on the backside, right around where your elbow is, you're going to have pain. And where it comes from, it's usually an overuse injury that happens when the muscles on the back of your forearm here get strained a little bit. Some of the things that happen is, A, you're overusing it. That doesn't mean not play tennis. What it means is you got to figure out why the muscles are working so hard. What we find is a lot of times issues can arise from the neck. So if you're having any neck stiffness, neck issues, neck pain, things like that, it can sometimes radiate down to the elbow and it can manifest itself as tennis elbow. So one of the things that we do here to kind of help with that, there's a lot of different things that we can do. A, some massage to the area will help. We like to use dry needling because dry needling really gets deep down, and if you don't know what dry needling is, we have another video on our website that talks about dry needling. But it gets deep down into where those issues are and actually helps heal the tissue. We check the neck and we make sure all the systems are working together. And believe it or not, one of the number 1 causes of tennis elbow is shoulder weakness. So if you've got a weakness in your shoulder, you're going to overcompensate by using your elbow and your forearm a little bit more. And that's what we tend to see. So we're really good at getting our hands on it, fixing it, keeping you guys playing tennis, especially if you're having elbow pain. This is something to look for. The braces will typically give you short-term relief, but they don't fix the problem. We're here to fix the problem, fix the root of the problem, so that you can keep playing tennis until you don't want to anymore. So, what's number 2?
Our next one kind of goes along with the first one. It's going to be shoulder injuries.
Look at that, right? So, specifically what we see with tennis injuries in their shoulders come from the rotator cuff muscles, right? And Lauren, if you don't mind turning for just a second, your rotator cuff muscles are going to sit on the back here, and their job is to make sure that that shoulder joint is in the right place as you serve, as you swing. It's supposed to hold that joint in place so that it does what it's supposed to. Sometimes the muscles aren't working the way they need to, so what happens is the bone from your arm here and the bone in your shoulder up here, they bang into each other. And as they bang into each other, they create like a pinch, or what we would call impingement. If done over and over and over again, leads to injury, leads to pain, leads to shoulder issues. That can be problematic if you're serving overhead. It's going to be hard for you to serve if every time you lift your arm up, you're getting a pinch. So I don't know if anyone's pinched you before, but if you pinch yourself in the same spot over and over and over again, it's going to get sensitive, it's going to get painful, and it's going to lead to issues later. So one of the things that we do here is we try to help maintain that space so that we're not having that banging of the two joints together, and it allows more motion. It takes a skilled therapist to ensure that the joint is moving the way it's supposed to throughout the range of motion. Otherwise, you can rest it, and as you rest it, what tends to happen is it feels good when you rest, but then you go back to playing tennis, and then those joints start banging into each other again, and then bam, you're back in the same spot you were. So you get frustrated, you can't play tennis, you've rested 2 weeks, now you still can't play tennis. It's a long cycle that just repeats itself, and what we want to do is get you out of the cycle, get the shoulder moving the way it's supposed to. As our owner would say, remove the rock, right? So he talks about a rock in the shoe. Once you remove the pinching, you remove the impingement, the tissue is allowed to heal, and it gets better from there.
And our next one is going to be back pain.
Tennis can be a very aggressive sport depending on whether or not you play singles, you play doubles. That's going to depend on how much you move, right? One of the things that we noticed, and all of our tennis players that come in with back pain, if we look, this is your pelvis here, right? And your pelvis is supposed to move, so it moves and it rotates, and that helps your back move as well. When your pelvis doesn't move, your back has to do more of the motion. It's not designed to do that. It's allowed to help you move, help you create stability. It's not designed to do all of the work. So when you've got your pelvis is hanging out on vacation, your back's playing tennis, that's when we start to see back pain. And it can be either sharp stabbing pain that doesn't allow you to get up and down from a chair. It could be dull aching pain that gets worse with time. I've seen all across the gambit, right? So the thing that we do is we want to make sure all the systems are working together, making sure the pelvis is working with the back and the lumbar spine so that you create more efficient movement patterns. So when you go to swing and you go to hit the tennis ball, whichever way, forehand, backhand, overhead, whichever direction you're going, your back's nice and strong and stable and it's moving with the rest of them. The two motions that your back does not like the most is what we call shearing. Shearing would just be like lateral, like just side to side movement, and then rotation, right? Guess what? Those are two things that happen in tennis. So the incidence of back pain occurs a lot when you're playing tennis because you're doing a lot of lateral movements like side to side, and you're doing a lot of twisting when you're swinging either your forehand or your backhand. We want to make sure, and what we're really good at, again, is making sure that those joints are moving the way they're supposed to, so one joint's not overworking itself, and that will prevent you from having increased back pain or chronic back pain, which is what some people that play a lot of tennis tend to develop over time if they don't take care of themselves.
And our next one is going to be knee pain.
All right, so the knee helps us move all over the place. It's one of the things that helps us get up and down off the floor, but it's also there to help stabilize us as we're chasing down tennis balls, right? Let's be specific to tennis. The one thing that we see a lot of is what we call patellar tendonitis. So if you can imagine, this is the front of your knee. There's the kneecap itself that sits on top. The tendon that attaches the kneecap to your lower leg is called your patella tendon. That tends to get irritated. It tends to get inflamed, and you tend to get a lot of pain doing things like jumping, squatting, bending down to pick up the tennis ball, whatever it is that you're having a hard time with, that's what you'll typically see. When that tissue gets irritated, it's very similar to what we talked about in the shoulder, right? It just keeps getting irritated, and it's just over and over and over again. And a lot of times the reason why it's caused, it's either caused by some sort of a weakness or an overuse thing where like the tendon itself is working too hard because the muscles in your leg, in the front of your leg, aren't doing enough to help create like your ability to start and stop. So you go from one side, you stop, that's putting a lot of stress on that tendon. Then you got to push off and go the other way. Well, depending on how well your bones move in the lower leg and how well your knee moves, depends on whether or not you're going to have an issue. So if you have limited range of motion, if you're having weakness in your legs, if any of those things are contributing, it's going to lead to pain in the last line of defense, which tends to be the tendons, the ligaments, those type of things. The last thing you want to do is have your knee hurting, go to play tennis, you go to stop, and then bam, your knee gives out on you. That's an ACL injury waiting to happen. We don't want that, because that's going to keep you out of tennis for at least 6 to 8 months, right? So we want to keep you guys playing tennis. The best way to do that is to make sure the tendons are moving, make sure the muscles are strong, and we're really good at that, making sure the bones are doing what they're supposed to, and they're moving efficiently, so A, your muscles don't have to work as hard, your knee's not bothering you while you're playing. And then one more, what do we got, Lauren?
And our last one is going to be ankle sprains.
Ankle sprains, we all know them, right? More commonly, we sprain the outside of our ankle versus the inside of our ankle, although the inside does happen. And it's, again, this is something that's not just in tennis players, but you think a lot about what we talked about earlier. Tennis is a game of starting and stopping, moving back and forth, trying to outmaneuver your opponent and get them running across the court. And all it takes is one false step and you can sprain your ankle. A lot of times, the lack of ankle mobility will lead to ankle sprains. Does that make sense?
Yeah.
So when the ankle's not moving effectively, it's not moving properly, it's going to go to what we call the path of least resistance. In our nature, we're lazy, meaning that we're going to go the easiest possible direction. So that your bones and your joints work the same way. If you get to a certain point and you have nowhere else to go, it's going to resort back to the easiest possible motion. And a lot of times that's when you plant your foot rolls out, and then you sprain the outside of your ankle. That can be very problematic and troublesome because you need to be able to plant and push off and do these things so that you can play tennis the way you need to get to that ball in the corner. Ankle mobility is key. Not a lot of people, they think, oh, if I just do this exercise, it'll help my ankle move better. Sometimes that is true, but remember, when you stretch, you're going to move through the least possible resistance. Not a lot of people push themselves to stretch in the tightest area, and that's what we're good at getting to. We're good at getting the most restricted areas moving so that that ankle's nice and loose and free, so that when you do plant, you don't have to worry about it giving out on you and spraining your ankle. I think at this point we've touched almost every body part, but all these parts are important because tennis is not a stationary sport, right? You're moving along back and forth, you're doing a lot of those things. It's very important that you get the arm, the shoulder, the back, the knee, and the ankle all moving together in unison so that your tennis game stays strong and that you stay, I don't know what, serving aces, is that the term? Right?
I think that's right.
Do you have anything else, Lauren?
Yeah, so we have been hearing a lot about ankle sprains. People are getting back into tennis as a hobby or exercise for the new year. So, as always, if you are struggling with any of these injuries, please give us a call and we will get you in with one of our expert therapists as soon as possible.
And we look to keeping you guys on the court and making sure that you continue your tennis journey. Thanks for joining us another week. We look forward to seeing you next week.
Bye.
Bye.